So this is Austin Oduor. I'm a clinical officer registered here in Kenya. I work in one of the hospitals not far from here. Yeah, clinical officers have been in existence here in Kenya since the early 1920s, and we are like 20,000 clinical officers here in Kenya. In Alupe, for example, where we are here, this is a level 4 hospital. In Kenya, hospitals are categorized from level 5 to 7. A level 4 hospital is that hospital that has got the outpatient services, the inpatient, and there are also wards for maternity and other services that are offered, like a comprehensive care clinic. So here the clinical officers work in the outpatient. They see patients, they send them to the lab, they diagnose and they write medication. There are also clinical officers who are performing minor surgeries. They do circumcision at this level. Here there are also clinical officers who work in the comprehensive care clinics. There are those small clinics, the HIV clinic and the specialist clinic. They are clinical officers who have specialized. The clinical officers who are specialized, they work in specialist clinics, and some of them work in level 4, 5, 6 hospitals. We have different specialties in clinical medicine. We have the ENT, the eye. We have the eye where the ophthalmic clinical officers. We have the reproductive health specialists, the clinical officers who are specialized in lung, skin, dermatologists. So even the anesthetists, like some areas level, this hospital, at this level, we have theaters. So small operations like cesarean sections, major operations, like cesarean section, are performed by clinical officers, reproductive health, and even the clinical officers anesthetists who provide anesthesia. So those are some of the things. Even cataract surgeries, the eye specialists, they do them. Yeah, clinical, we've been neglected for so long, but since the coming up of a union, in Kenya, I can say it's only Kenya and Malaysia that are gifted to be having a union of their own. The union always push for demands to the government, increase of salary, maybe remuneration, maybe appointment. So Kenya, the clinical officers, we are at a different level. We even fit in these high level positions in the hierarchy of the medical field here in Kenya. We have the Director of Clinical Services, who is at the top, at the headquarters in Nairobi. Down there, up to the level where the clinical officer who is heading these types of levels, level 1, level 2, 3, 4. So the clinical officers are motivated by a strong association, a strong union, and a very well-functioning regulatory body, which is called the Clinical Officers Council of Kenya. Yeah, I want to tell the whole world that clinical officers in Kenya are the champion of universal health coverage and the custodian of primary health care. And clinical officers have improved lives in Kenya. Without the clinical officers, then Kenya will not be the Kenya that people see. Even this idea of the coronavirus, you see the clinical officers who are doing the screening at the border point and the entries. Yeah, so let the whole world, let us embrace this type of cadre, because in other countries they are called the physician assistants, some call them the physician associates, some the medical assistants, some assistant medical officers, some call them even the clinical associates, like in South Africa. So we've come up with a body that is bringing all these people together, and that is why we have the GACOPA, the Global Association of Clinical Officers and Physician Associates. GACOPA is an international body that was formed by like-minded clinical officers and PAs and the equivalents, that they wanted to bring this type of cadres. We have like 25 titles in 46 countries spread across the world. So we wanted to bring them together, and that is what we have been doing since 2018 when GACOPA was formed. We held our first conference in Accra, Ghana. We are now holding our second conference next week in Kigali City, that is Rwanda. So I'm the president of that association. I was elected in Accra, Ghana. I think I'll be defending my position when we go to Kigali. And we really want to bring everyone on board. We've brought Malaysia on board. Malaysia has come with a lot of experience, wealth, but they needed that international connection. So with the 26,000 medical assistants in Malaysia, 7 of their top representatives are also coming to Rwanda. So we want to bring all, until that time, the journey has just begun. I'm very sure in 3 years' time, clinical officers, PAs, clinical associates, medical assistants will come together and form a very strong, united body under in GACOPA, or we strengthen GACOPA like the doctors and the nurses and other cadres are also doing. You see, the main aim why GACOPA was formed was to bring clinical officers and equivalents together, the PAs. 2, we've been pushing to have a common name. The name might not be 1, maybe 2, but a common name. If you go to the United States, you tell someone I'm a clinical officer from Kenya, that person will say, no, I know of clinical officers, they are the physician assistant. So that idea of common name, a common curriculum will definitely come when there are structures put in place. So those are the reasons why GACOPA was formed. And I believe here in Kenya, there is a year like 15 years ago, no one knew who a clinical officer was. They always know these patients you see here, they call a clinical officer medical doctor. They use that term in Kiswahili, daktari. So until you will explain to that patient that no, I'm a clinical officer, that patient will know that you're a medical doctor. So there is a campaign that we started here in Kenya where we put name tags, written clinical officer. Wherever you go, you tell even the patient that I'm a clinical officer, this is what we do. And then we also enhanced our cap. There is that cap that we have in Parliament, the Act. We really enhanced it, and there is a clear job description. It's very clear in the law who a clinical officer is, what a clinical officer does, what other cadres also do. So that is what we also want to replicate in other countries, and we really want to know by 2025 we should be up there where WHO, even the Director General of WHO when he works, he say yes, the clinical officers. Yeah. I want to tell the whole world that clinical officers, the physician assistants, the clinical associates, the medical assistants, and equivalents, and analogs, all those names, we want to say that we were neglected before. We were not known. Now it's the time the whole world should know the role that we play in primary health care, in universal health care, and we should be incorporated in everything that WHO or any agency that is involved in health is doing, that we have started it, and GACOPA is the way to go. I've heard of it 2 years ago, and there are people who are tasked that are coming up with that kind of name, and they've approached WHO. As GACOPA, we really appreciate that, and we are fully behind Africa accelerated clinically trained clinicians, and we'll offer any support that is needed, and we also work with them together because they are part of GACOPA and GACOPA is part of them. Through the Clinical Officers Council, the body that regulates the training of clinical officers, they are allowed to open and register their own clinic under their name, and it will be recognized by the government. They don't need to go to the board that regulates doctors. It is theirs. They can even run a hospital using the license from the Clinical Officers Council, and that was a plus. And recently, even the National Hospital Insurance Fund gave the clinical officers green light to now order for specialist investigations, which was not there before. So the progress and the gains being made in Kenya for the clinical officers through the Act of Parliament and amendments and the Clinical Officers Council is very tremendous, very great, and very, it's a huge step that we want all other countries that also have the same type of cadre to follow. I want to make a statement. Something happened here in Kenya. The medical doctors went on a record 100 days strike, and you realize that it was everywhere in the world in the news that Kenyan doctors are now hitting their 100 days on strike. But on the ground, things were just normal. You could see patients coming, operations taking place, because 98% of all outpatient cases in Kenya are seen by clinical officers. 95% of all surgeries done in Kenya, the anesthetist is a clinical officer, meaning that anesthetist will still be at the hospital. Major surgeries like cesarean section are done by clinical officer reproductive health. You find the doctors now working in private hospitals. So again, you find that 90% of all cataract surgeries are done by clinical officers, ophthalmologists, because they are the largest in numbers in the country. So there was no total paralysis even during the doctor's strike. And that is why the government was so confident, and that's the time that the government increased salaries for clinical officers by $300 US. The record stands at 21,000 clinical officers in Kenya against 8,000 doctors in Kenya. And nurses are twice, they are around 40,000. So the 21,000 clinical officers, 6,000 are employed by the government of Kenya. Another 10,000 are employed by non-governmental organizations. And you realize that all HIV programs, all TB programs are manned by clinical officers. None other than the clinical officers. That is why the health system or the healthcare in Kenya, without the clinical officers, it can't work. And if the clinical officers call for a strike, then the government will act with speed to bring them on board to avert such a strike, because they are the custodian of primary health care and universal health care in Kenya.